Good morning, folks. This is John Adamson, the Rehab and Documentation Guru. Having one of those home health days where it seems like every patient of yours is hard to schedule. And those of you that do home health can relate. What I wanted to do today is to talk about statin medications. And one of the things that we prove that shows that we are the most safe and effective way to work with the patient is that not only do we have a complex patient, but we have a complexity of knowledge. And those of you that have been following my channel for a while know that I changed the title of my channel a while ago to include not just documentation, but to talk about rehab specific concerns. And one of those concerns is a complexity known as medications. Let's face it, folks, we see patients with a lot of medications that they're on, and this is a complexity. And the other day, I saw a patient with various and sundry complexities, comorbidities, and one of the things he was complaining of was thigh pain and thigh weakness, and he's had a decline in this particular area. And I looked at his medication list, and lo and behold, he was on a medication that I suspected he might be on that caused it. And you will know from the title of this video that I'm talking about a statin medication. Real quick, let me talk about statins for a minute. Lipitor, one of the most common ever statin medications, is the #1 best-selling pharmaceutical of all time. Think about that. There's been a lot of drugs out there that could vie for that title, and Lipitor is the top dog. And statins are one of the most highly prescribed medications out there right now. And they're projected to grow in popularity and prescription. And I'm not a doctor, so I need to say that first and foremost. I'm not a researcher. I look at research. I listen to doctors talk on various topics. Benefit of home health is I listen to videos as I'm driving and try to educate myself. And this is a particularly interesting topic to me. And one of the potential side effects of statin medication can be pain in muscles, and also weakness associated with statins. Now, I've seen different statistics on this. Some suggest it's around 30%. There might be other studies that show less or more. I'm just not aware of them because there's been a lot of studies on statins. However, with that said, it's a complexity we need to think about. And so this patient with the muscular pain and the muscular weakness has a statin medication prescribed, and that muscular weakness is causing functional decline with transfers and gait for this guy. I mean, it's one factor, not all factors, but one factor. And so this concern is concerning to me because I want to get to the root cause of all his problems, and I want to help him solve them. Now, I'm not a doctor. I can't change his medication. All I can do is report to the doctor what his clinical signs and symptoms are. And hopefully you'll have an astute doctor on the other side who will analyze this and say, okay, this medication, which may include a statin, may be contributing to that. And then the doctor decides the risks of this patient not being on a statin is higher than the risk of this causing pain and weakness in their muscles. So that's going to be up to the doctor at that point. But I would highly, ask you to get educated on drugs like statins, because one of the things that we use cholesterol for in our body is cellular membrane development and maintenance of health of our cellular membranes. So we need both HDL and LDL. In fact, the body produces its own cholesterol. So the body produces it, and if you happen to believe, like me, that there was a designer of our bodies who had a purpose for everything that the body does naturally, that maybe we need some of that. And so by artificially lowering it, maybe we're causing harm. Anyway, I don't I'm not bringing this up to have you confront doctors and say, well, maybe this patient shouldn't be on a statin drug, but to be aware of the complication associated with this medication that may be limiting your patient's capability and improving in function, because we do need to consider that. And when you demonstrate that you have knowledge that this is a potential concern and you put that on paper, you are demonstrating a complexity of knowledge such that maybe you should be safely and effectively delivering care to that patient, because obviously that would cause you to modify the patient's exercise prescription, adjust how that patient does ADLs and activities, and that's evidence of knowledge and skill. Anyway, this has been John Adamson, the Rehab and Documentation Guru, talking briefly about statins, urging you to get more educated in this area, and all medications, of course, and wishing you a great and happy day. Take care. God bless.